Hi, I'm Dr. Srilekha and today we'll deal with Clostridium tetani. Let's begin with the morphology. So, Clostridium tetani is a gram-positive motile rod-shaped organism which is slightly curved bacilli which is having a diameter of 2.5 into 0.4 to 0.5 μm and which occurs in chains or single in shape. The spores which are present are usually over the terminal part of the bacteria, which gives a drumstick appearance. Coming to the cultural characteristics, they are anaerobes and they grow in a maximum temperature of 37 degrees Celsius with a pH of 7.4. They grow well in the ordinary media and the growth can be improved when it is added with serum or blood into the normal medium. That means they can even grow in the normal medium, but in order to facilitate the growth when blood or any other serums are added, it can improve their growth time. Next, we'll see about the biochemical reactions. So, the first one is it is slightly proteolytic. Proteolytic means they can break down the proteins, and there is a gelatin liquefaction which occurs very slowly, and there will be no fermentation of sugars. So, whenever they are into any type of agar or any sort of sugar substances in which they are having any media, there will not be any fermentations taking place. Next, we'll see about the resistance. So, most of the strains are killed by boiling for around 10 to 15 minutes, but some can even resist up to 3 hours. So, usually all the bacteria in this group die within 10 to 15 minutes, but some can withstand to around 3 hours. The spores are killed with iodine, hydrogen peroxide, and glutaraldehyde. So, when you're boiling anything and you're adding some substance like iodine, glutaraldehyde, or hydrogen peroxide, it can improve their the pattern of the destruction is more when you add these substances to the boiling water. Next, we'll see about the toxins. So the first one is tetanolysin, and in which it is a heat labile toxin, and here there will be increased lysis of erythrocytes. That is, this toxin can cause an increased lysis of RBC, and it also acts as a leukotoxin. Coming to the second toxin, it is a tetanospasmin. It is also a heat labile toxin, and here it is also an oxygen stable toxin, and it is a power neurotoxin. Then rapidly gets destroyed by the proteolytic enzymes, and also it can be neutralized by the antitoxins. That means there is a anti-agent for the tetanospasmin. It gets neutralized only by that agent. Coming to the pathogenicity, so Clostridium tetani mainly affects the humans by causing a disease known as Clostridium. This organism is caused by a disease known as tetanus. And the spores, so what is really happening here is that the spores enter into the host through any open cuts or laceration which we are having most of the dead skin or cells around the cut, and here this dead skins provide a perfect environment for the growth or the multiplication of the Clostridium tetani organism, and it spreads to the human body. In the presence of anaerobic condition, that is, the spores can germinate, and this is when spores produce toxins and they can even enter into the nervous system. So, the main aim of the toxins of Clostridium tetani is to attack the nervous system of a human body. So, that is their main aim. So, let's see what is happening in the condition. So, the toxin known as tetanospasmin, which we have already discussed, travels through the body via the nervous system, where its goal is to reach the spinal cord. So, their main aim, as we told, it is to attack the nervous system, and through the movement of the toxins, they reaches the spinal cord. And here, what happens is that the toxin really begins to attack all the body cells, and the toxin interferes with the neurotransmitter and thus blocks the messages to the brain. So whatever happens, like for example, if a patient who is affected with Clostridium tetani, he is touching something hot, and the impulses are not reaching the brain. This is what is going to happen, and so the neurotransmitters are completely blocked, or it will not act. So that is happening in Clostridium tetani. So, In this condition, this leads to the unwanted muscle contraction and spasm, and in bad cases, the individuals can experience severe seizures. So what is really happening is that when the toxins of Clostridium tetani affects the CNS, there is an involuntary or involuntary, which we cannot control, contraction or spasm is happening in the patient, and conditions which there is an increased toxin level in the body can even end up having severe seizures. So this is what the manifestation happens. So the clinical pattern of generalized tetanus consists of severe painful spasm and rigidity of the voluntary muscles. So all the voluntary muscles will be having in very much of rigid condition, and also there will be a painful spasm as well. So the characteristic symbol or the symptom of Clostridium tetani is lock jaw, which is that is the muscles of masseter, that is the muscles which we are having over the cheek, which is getting very much of spasm and constricted, and which leads to the progressive rigidity and violent spasm as well. So apart from the masseter muscle, there will be also the same thing, that is the spasm and the rigidity can also affect over the trunk muscle as well as the limb muscles. When there is spasm seen within the pharyngeal muscles, over the pharyngeal muscles, when you are having the spasm, what happens is that the patient will be having a difficulty to swallow, and even sometimes the patient can have like they can end up on death in cases when there is any effect to respiration, that is because of the paralysis of the muscles of the respiratory tract. They can also lead to a fatal condition. So earlier the masseter muscle are affected. So that is the first symptom. That is, first initially the masseter muscle will be affected. After that it can progress to the spasm of the extensor muscle of the body. Then it comes to the limb. And when when the spasm of all the muscles are happening, the position of the people will also change. That is, the normal posture will be changed, and the posture is known as opistonous posture. That is what known as, that is their bone will be in an arc shape. The body moves into an arc shape. That is the posture's name. Now let's see about the laboratory diagnosis. So we are having two laboratory diagnoses mainly, that is the hematological and the microbiological. So in hematological, we don't see much differences within the blood cells. So there will be no vital definition or changes within the blood cells. Coming to the microbiological features, we will be going with the microscopic study, culture studies, biochemical studies or tests, and animal inoculation test. So these are the four tests which we do under the bacteriological investigation. The first one, that is the microscopic studies. In that, what we do is that we take a smear, that is the cells or the swab from the like the lacerated area. Sometimes we can also take the pus as well from the wound area, and we'll do the gram staining. And while gram staining, it will show gram positive bacilli, and it will have a shape of drumstick as well. Coming to the second one, that is the cultural studies. When the specimen is inoculated in a blood agar, so we usually prefer the blood agar, and the organism will produce a large colonies after 1 to 2 days at 37 degree Celsius in anaerobic conditions. So they will not grow as soon as the when the specimen is placed into the agar. So it requires around 1 to 2 days with a temperature of 37 degree, and also in an they are best the growth can be best seen in an anaerobic conditions as well. Coming to the next one, that is a biochemical test. So in this biochemical test, we will be talking about some of the tests which we do, and why we are telling is that when this Clostridium tetani bacteria react with the particular test, so whether it will show a positive result or negative result, that is what we are going to see. So when the Clostridium tetani bacilli come and react with sugar fermentation test, we will get a positive result. When it comes to the indole test, it will be again positive. The third one, that is the H2S production test. When you do with this, you will get a negative result. And the fourth one, that is the gelatin liquefaction test, and you will get here a positive result. Next is the MR and VP. MR means methyl red, and Voges posture red test. That is the protocol. There is two tests which we do, and in this test also we will get a negative result. So when you get, you can also expect questions when you can have a question like, for example, what will be the result of when a Clostridium tetani react when an indole test? Whether it will be positive, whether it will be negative, or false negative, false positive. You can get questions like that pattern as well. Next, we'll see about the treatment. So for the treatment, we are having the first one as surgical method. So in the surgical method, what we usually do is that the removal of the dead and damaged necrosed tissue which is contaminated. It can have pus, foreign bodies, clots and all around the wound. We have to discard or remove the particles from the healthy tissue. And the second one comes to the antibiotics, that is we have to treat the patient with antibiotics, that is mostly penicillin group and erythromycins are the best result showing antibiotics. Next, we'll go to the vaccine. So we have heard that Clostridium tetani can be also prevented with the help of vaccines. So we have two types of vaccines, that is active vaccine and passive vaccine. So the first one is active vaccine. And in that we'll see the first one, that is the tetanus toxoid, which is also known as TT, and it is given in 3 doses with 0.5 ml intramuscularly, and the immunity period of TT is around 10 years. And the second one is DPT. DPT means diphtheria and pertussis and the tetany. So these three includes DPT, and it is usually given along with the diphtheria toxoids, especially for children. And this is also having a 3 dose which is given intramuscularly before the age of 6 weeks, and the booster doses are from the 18 months and 5 years. So we are having totally 3 injections for DPT. One is before the 6 weeks, and next is around 18 months, and the third one is at the 5 years. Next, we'll see about the passive vaccination. So here in passive vaccination, we take the anti-tetanus serum that is prepared from the immunizing horses, and the doses which we give is 1500 unit intramuscularly as well. And there is an increased chances of hypersensitivity here because as we are taking the serums from the horses. So this is the serum which we are taking for passive vaccination. So with this, we complete Clostridium tetani. Thank you.